Think about the last time you poured yourself a glass of water. Maybe it was after practice, after school, or late at night when you were just tired. You probably didn't think about it, you didn't even hesitate. You just drank it. Clean water feels basic, almost invisible, something we expect will always be there. Now imagine finding out that the clean water you've been drinking contains chemicals that never leave your body and never leave the environment. Would you drink it the same way? Across the country, this isn't hypothetical. A group of chemicals called PFAS have been found in drinking water systems serving communities nationwide. PFAS are man-made chemicals used in everyday products such as non-stick cookware, firefighting foam, water-resistant carpets, waterproof clothing, and dental products. Chances are you've touched something today that was in PFAS. PFAS contamination occurs when facilities usually transfer them through water. PFAS doesn't look unusual either. There's no visible color change and no distinct smell. It can exist in water that appears completely blue. PFAS are often called forever chemicals because they don't naturally break down. Most chemicals degrade over time, but PFAS don't. Once released, they remain in soil and water for decades. Once inside the human body, they accumulate. They travel through groundwater and spread far beyond their original source. Contamination that begins at one facility can eventually affect entire regions. Okay, well the slide isn't here, but in the slide we could have seen multiple health effects of PFAS exposure on the body. It affects multiple parts of the body, including the immune system, liver, hormones, cholesterol levels, and child development. This isn't just science, it's someone's real life. In this slide you can see Bucky baby. Bucky was born with severe facial deformities after his mother worked at DuPont while pregnant and was exposed to PFOA. PFAS used in manufacturing. His case was one of the first to bring national attention to the dangers of PFAS, and his story shows how chemical exposure can impact a child before they're even born, long before families fully understand the risks. If one story feels heavy, imagine what the numbers would be. 172 million people in communities throughout the nation have drinking water that was tested positive for PFAS. That's more than half the country. This number shows just how widespread this issue is. Contamination has been in many families and it affects millions of people. If contamination is so widespread, the question becomes, why has it persisted for so long? For decades, PFAS were widely used with limited recognition. Industrial production expanded faster than ever said. Testing requirements were inconsistent, and enforceable federal limits have only recently been triggered. This isn't just an environmental crisis. This is an environmental justice issue and a public health issue. Communities near industrial facilities, manufacturing sites, and military bases are often most affected. Areas that rely on groundwater are more vulnerable to contamination. PFAS contamination isn't easily removed. Contamination needs advanced filtration systems which cost millions of dollars to install and maintain. In some cases, contamination spreads so broadly that long-term management becomes the only realistic option. That's why prevention and accountability are essential. Stronger testing, updated regulatory standards based on current science, and financial accountability from polluters are all part of long-term solutions. Addressing contamination requires policies grounded in research and public health. When we talk about PFAS, it's really about responsibility. It's about the people who started this issue, who will fix it, and who will prevent this from happening again. It's about the future we want to see, a future where communities don't have to fight for basic rights, where water is something we can expect, not something we have to hope for, where science is taken seriously before harm spreads, and convenience is something that doesn't have to come at the cost of safety. The next time you pour yourself a glass of water, I don't want you to feel fear. I want you to feel awareness, because awareness leads to accountability, accountability leads to change, and change is what's going to turn clean water from assumption to a promise. Clean water should never be a privilege. It should be a promise we're informed enough to question, strong enough to demand, and committed enough to act. Thank you.